Thank you, everyone, for joining us for our monthly Researcher of the Month here at MOASC. And we're going to feature today Dr. Karen Reckamp, who is a mentor and colleague of mine. And Dr. Reckamp is a clinical professor at UCLA and at Cedars Sinai Medical Center. She's also division director at the Cancer Center over at Cedars Sinai Medical Center, and we're ecstatic to have her here. Thank you so much for joining us, Dr. Reckamp.
Thank you for having me, Dr. Lashkari.
Thank you. And I've always had so much fun picking your brain, sending patients to you, and I know that and for patients, with lung cancer, and I know that this is your area of expertise and something that you're so passionate about. So much has been going on in the area of lung cancer research, and today we just wanted to get a glimpse into your particular area now that you're focusing on, some of the areas that you're focusing on in your department, in your clinical research. Please share with us some of those areas that you'd like to highlight.
I appreciate this opportunity, and it's really an exciting time for research and clinical research in lung cancer. We've seen, survival benefits from targeted therapies and immunotherapies, and I think some of the exciting prospects are moving these therapies into the neoadjuvant and adjuvant settings, and we're evaluating that. But unfortunately, still many patients who receive these therapies develop resistance. So much of the work that we're doing, especially in some of the translational work, is looking at mechanisms of resistance to both immunotherapies and targeted therapies. One of the trials that we presented at ASCO this year was part of the lung map run through the NCTN and SWOG that looked at ramucirumab and pembrolizumab following immunotherapy and chemotherapy for patients who had prior response but acquired resistance to immunotherapy, immune checkpoint inhibitor therapy. And we found an improvement in overall survival in that phase 2 trial. So that's an exciting area that we also want to move forward in.
That an area where you're now looking at a phase 3 trial for that combination?
That would be the goal, to move it toward phase 3 and really confirm those results.
So that's wonderful. You had mentioned a couple of areas in terms of overcoming resistance. Are you looking at that in terms of the small molecule inhibitors?
So we do. We're always interested in understanding resistance. We have now 9 different targets that we can treat patients with lung cancer with targeted therapies, but unfortunately the majority will have tumor progression, and though we see improvement in survival across the board for patients with lung cancer, we still have a ways to go. So some of the work that we are doing here with a collaboration of one of our labs with Dr. Neil Bomick, we're working on looking at overcoming resistance and the tumor microenvironment to try and rid the cell of persister cells, especially in EGFR mutant non-small cell lung cancer. And we'll be opening a trial looking at the combination of a drug carotuximab and osimertinib very shortly, probably later this month, to evaluate whether we can overcome resistance to osimertinib for EGFR lung cancer.
Actually the question, which is,
we lost you.
That was actually my next question. What trials are you either have open or are excited in terms of opening up soon? And so it sounds like this particular trial looks very exciting, and I take it this is for patients. This would be a study that would enroll patients who have previously received osimertinib and have progressed.
So we'll do a dose escalation that will look at more refractory patients who received osimertinib or other therapies. And then there'll be a cohort of patients where we're going to look at cell-free DNA and those who have continued shedding in a early period, so that maybe we can eliminate those persister cells earlier in the process, but that'll be in the expansion phase.
Very interesting. And I think a lot of us out in the community who are taking care of patients like that have the EGFR mutation are certainly ones that we want to help continue going forward with easier therapies that don't necessarily transition them from targeted therapy to chemoimmunotherapy, which, as we know, doesn't have the same level of response that targeting the EGFR inhibitor or process or pathway does. Yeah.
Exactly.
Any other trials that you're interested in sharing with our audience?
So again, I think that trying to overcome that resistance that most patients' tumors will develop to immune checkpoint inhibitor therapy has really been the area that we need to hone down on and get some new therapies. So very excited about moving forward with the phase 3 trial to evaluate the ramucirumab and pembrolizumab. And there are probably a number of trials that will read out in that area. But again, we're always looking at new novel agents to try and overcome that resistance and stimulate the immune system better.
Thank you so much, Dr. Reckamp. This has been very exciting for us to have you here and to hear about your research and the areas that you're exploring. And what we'll do is we'll share some of the active trials that you have, and will hopefully be opening up, as you just mentioned, to our membership. Thank you so much.
Great. Always great to talk to you.